I want to welcome the members, staff, and any guests we may have. I don't know whether there are guests today. I assume that that there are lawyers on the phone. There will be lawyers on the phone. Our guests, welcome. We met here in New York City. We met in this room, I think, the last time in May of last year. Did I get that right? And we thought that that would be the reopening of our regular meetings in this facility and in Albany and in Buffalo. Unfortunately, that was not to be. COVID spiked again, and we went home again. And we've been home for, what's that, 11 months? Have I gotten that right? 10 months. It is really good to see so many people in this room, as well as people who are on the phone in the various locations. Thank you all for being here. For those of you who traveled from Albany, thank you for doing it. It's just good to be in the room with all of you, because the sidebar conversations really do matter, and I enjoy them very, very much. We have 3 board meetings today. The 2 subsidiaries will each have an annual meeting, and then we will do the regular the board meeting that is scheduled for this month. That said, let's get started. We will open the meeting for Atlantic Avenue Healthcare Property Holding Corporation, and I will ask Sarah to read the roll, however you say that.
Great. Thank you, Mr. Chair. We have with us today our board members, Al Carney, Vice Chair John Johnson, Beryl Snyder, Jerry Romsky, Janice McKinney, Phyllis Morris, Ken Evans, and Wellington Chen. From DASNY staff, we have our president, Ruben McDaniel, Vice President Paul Koopman, Nadine Fontaine, Portia Lee, Ricardo Salomon, Kim Ellis, Steve Currow, Kathy Ebert, Craig Schreivogel, Alex Sardine, and David Ostrander. Steve Kosher has joined us by phone this morning. Matt Bergen, myself, Sarah Richards, and Amanda Nazario, and Deb Fasser. From outside counsel, we have Damon Pace, Allison Radicke, Michael Cobbs, and Melissa Bennett. And with that, Mr. Chair, I will turn it back over to you.
Excuse me, Sarah.
Yes?
It's Joan Sullivan. I don't think you read my name.
Oh, I'm sorry. I thought, okay, Joan, you're with us as well. I apologize for that.
Thank you.
Glad you could join us. I know you're on vacation. Thank you very much.
No problem.
Joan,
And Dina
thank you.
Amodio is with us too this morning.
Joan, thank you for being available for this meeting. I know you're away, and I didn't think you were going to be able to do it because of digital difficulties, but clearly you figured it out. Thank you.
You're welcome.
The first order of business today on the Atlantic Avenue Healthcare Property Holding Corporation agenda is the election of officers. You have received the roster of officers for the subsidiary. Are there any questions about the roster of officers? Hearing none, then may I have motion, please, to adopt the resolution which designates the officers for the holding company.
So moved.
Thank you, Wellington. Is there a second?
Second.
All in favor, please indicate with aye. Aye.
Aye.
Are there any opposed? Are there any abstentions? Hearing none, the motion carries, and it carries unanimously. We have minutes from the January 5th, 2022 board meeting for this company. Does anybody have any questions or comments about the minutes, or any corrections, actually? Hearing none, may I have a motion, please, to adopt the minutes?
I'll move.
Thank you very much, Beryl. Jerry, thank you for the second. All in favor, please indicate with aye.
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 Are there any objections or any abstentions? The motion carries, and it carries unanimously. We will go to the mission statement and revised performance measures and metrics for Atlantic Avenue. Sarah will explain what we're doing, and we will then discuss if necessary and take vote. Sarah?
Yes, thank you. As the members know, the Atlantic Avenue subsidiary property holding corporation, as a subsidiary of DASNY, adopts all policies, procedures, et cetera, of DASNY as its own. However, we are required to review a few documents on an annual basis, which we are doing today. The first of those is the mission statement and performance measures and metrics. Those were reviewed by the governance committee of Atlantic Avenue on March 1st, 2022, last month, and no revisions are being recommended at this time. So, Mr. Chair, if the board will get a motion and approval of the mission statement and the performance measures and metrics, that will take care of that item.
Thank you. I'll first thank John Johnson for officiating at that meeting in March. Thank you, John, for getting that done. Challenge. Are there any questions or comments on the mission statement, the performance measure? Hearing none, may I have a motion, please, to approve them?
So moved.
Jerry, thank you very much. Wellington, thank you for the second. All in favor, please indicate with aye. Aye.
Aye.
Are there any opposed? Are there any abstentions? Hearing none, the motion passes and it carries unanimously. Sarah?
Okay, and then the last action item that we have before the president's report today is a review of the Atlantic Avenue subsidiary bylaws. Again, the governance committee for Atlantic Avenue reviewed those in March, and no changes are being recommended at this time. So again, Mr. Chair, we'll just need approval of the full board of those, and that will take care of the action items for Atlantic Avenue.
Thank you very much, Sarah. Are there any questions from any of the members about the bylaws? You certainly had a chance to review them. Hearing no questions, may I have a motion, please, to approve?
So moved.
John Johnson, thank you for the motion. Wellington, thank you for the second. All in favor, please indicate with aye.
Aye.
Aye. Are there any opposed? Are there any abstentions? Hearing none, the motion is approved. The matter carries unanimously. Mr. President.
Mr. Chairman, I'm going to turn this over to Craig Schreiberkel, who's going to give my presence report and give a quick update on Atlantic Avenue. Not much activity, but Craig?
Yeah, sounds good. Thanks, Ruben. For all you baseball enthusiasts, it is not lost on me that the subsidiaries get to bat leadoff today instead of the typical 9 slot. So I'm setting the tone. I'm setting the tone for the next hour and a half. I hope I don't screw it up. All right.
Me too.
Very good.
But yeah, good morning. My presentation today is intended to provide a brief overview of the annual Atlantic Avenue President's Report, which is included in the board materials. I will touch on the history leading to now and events that transpired over the last year. So I believe all are aware that Atlantic Avenue came to own how that, excuse me, I believe all are aware how Atlantic Avenue came to own the Interfaith Medical Center campus, as that detail is included in the written report and was shared with the board in numerous previous verbal presentations. Just know that Atlantic Avenue continues to lease property back to Interfaith following the medical center's emergence from bankruptcy in 2013. With nominal lease payments now prepaid by Interfaith through 2028, Atlantic Avenue uses its sizable reserves to pay property insurance costs, while Interfaith is responsible for all other property-related costs. As for current events, things were much less eventful this past year than they were the year before. If you recall, the previous annual report spoke of such things as Interfaith and Kingsbrook merging into Brookdale Hospital Medical Center, the long-awaited closure of the Interfaith bankruptcy case, the imminent refunding of the Interfaith secured hospital bonds through a state issuance, and the emergence of a worldwide pandemic. As for events this past year, Interfaith and the entire One Brooklyn Health System continue to progress with its transformation plan using funds from a $664 million grant the system was awarded in 2018. To date, approximately 25% of grant funds have been dispersed to OBHS by DOH for the various project components. The three priorities of this plan remain the establishment of a 30+ site ambulatory care network, integrated IT system improvements to standardize clinical and patient accounting applications, and the facility infrastructure investment to support the clinical restructuring of the system. Next, under the auspices of the Governor's Vital Brooklyn initiative and in combination with special legislation passed 3 years ago, a second parcel owned by Atlantic Avenue was conveyed in early 2022 following this board's approval, pursuant to a state-run RFP and a plan to create affordable housing and increase access and quality of healthcare services to transform Central Brooklyn. DASNY staff is working with New York State Homes and Community Renewal, DOH, DOB, and other state officials on the potential conveyance and transformation of 2 more Atlantic Avenue properties for a total of 4, and staff is expected to seek board approval in the coming year. Before I leave the Vital Brooklyn topic, I wanted to mention that staff is also working on a plan that would release mortgages on 2 Kingsbrook properties for low-income housing projects. While these Vital Brooklyn projects do not require any Atlantic Avenue action, because Atlantic Avenue does not own the Kingsbrook properties, I wanted to inform you of this because a mortgage on the entire Kingsbrook campus, including these 2 smaller parcels, helped secure a $29 million note owed to Atlantic Avenue for old lease payments not made by Interfaith. As such, Atlantic Avenue would be giving up a small portion of security, which collateralizes the note. My final update centers around operations. Interfaith and OBHS, One Brooklyn Health, continued to be affected by the COVID pandemic this past year. And like many other New York City hospitals, total volume has not fully rebounded to pre-COVID levels. The continued flow of state subsidy funding in combination with federal financial assistance for COVID-related expenses and lost revenue, along with Medicare accelerated payments, have helped Interfaith and OBHS financially endure continued challenges. Interfaith, or Brookdale, as I should more appropriately call it now, remains highly dependent upon state support, and staff expects this situation to continue this fiscal year. These represents the major occurrences related to Interfaith and Atlantic Avenue over the past year, and that concludes my prepared remarks. I'd be happy to take any questions. Thank you.
Greg, thank you very much. Jerry, you have to.
Yeah. Okay, there's 2 more parcels that we review and possibly convey as part of the DHCR's affordable housing program. What's left after that? That's still in that mix. Like,
I mean, keep in mind, Atlantic Avenue owns the entire Interfaith campus.
Got it.
And these 4 parcels that we're conveying, 2 have already been conveyed, 2 are to be conveyed, are very small pieces to the campus. So we're still going to own, the bulk of the Interfaith campus. And,
I'm assuming we're giving away the nicer parcels and left with something, no?
We're giving away what?
Will there be, when these other 2 parcels, assuming they actually get conveyed, there's certain property that's left, right?
Yes.
Maybe I could be assuming wrongly. The 2 we did and the 2 we're about to do, those are probably the nicer pieces of the property, maybe.
I would hesitate to say that.
Right? But what's left though? I mean, I guess my point is, at the end of the day, what is this subsidy going to own and hold, and for how long? And what do we do with
Understood. I'll take that in order. We conveyed 2 small parcels. We're going to convey 2 more small parcels. That's going to leave 90% of the campus still. We're still going to own 90% of the campus. Once we're done conveying these smaller parcels for low-income housing, through Vital Brooklyn. So, and that's gonna, we're gonna continue to own these, this interfaith campus for the foreseeable future. There is no true end date in sight. I guess you can maybe earmark 2028 as a possible, because that's when the lease ends with Interfaith. It could be renewed at that point, but a determination will need to be made at that point as to if the property flows back to Interfaith or if it stays with the state. And there'll be a lot of underlying decisions made by various state agencies in that determination.
Jerry? Okay. Are there other questions or comments about that we can give to Craig? Craig, oh, yes, John.
I just want to make sure I understood the numbers. I understood the numbers you just presented. Atlantic Avenue and all this property and everything else. It is existing now on a $228 million flow of funds from the state. Is that right? 228 million?
Yeah, I'll make the following statement. One Brooklyn Health, which is the parent over Interfaith, Kingsbrook, Brookdale, if you will, and we own the Interfaith campus. The state provides operational subsidies to that system, as they do 25 other safety net hospitals throughout the state. And that subsidy helps these safety net facilities that are highly Medicaid, Medicare, government payers in terms of their payer mix. They help them, quite honestly, keep the doors open and keep serving patients.
John? Yeah. Yeah, that's what I thought. I just want to make sure I had the numbers right.
Yep.
Are there other questions or comments for Craig? I have a question, Craig, and it may be a Ken Evans question. Ken's on the phone. What are we hearing from the community as we effect these changes? It may be too soon, actually, to know how the community is reacting because of COVID, because people are much more concerned about other matters, their specific COVID-related healthcare. But is the community commenting? Are there community boards out there that are asking us what we're doing and what the plans are? And do they know? Which is clearly the Ken Evans question. Do they know what the plans are?
Okay, can I clarify the question slightly?
Please.
So as we talk about the community and community involvement, are we talking about their knowledge of the subsidy and the transformation aspects that DOH is overseeing? Or are we talking about the Atlantic Avenue interface and the properties that are owned by Interfaith?
Yes.
Both. Okay. Then I'll let Craig speak to the Atlantic Avenue and I can talk about the subsidy a little bit. So the communities are actively involved in terms of the transformation initiatives that DOH is overseeing related to One Brooklyn Health, and as Craig indicated before, the other subsidy programs throughout the state. These are highly Medicaid hospitals, highly Medicaid and government payer utilized hospitals. Those hospitals need the subsidy in order to stay afloat, and the communities actively utilize those hospitals and support those hospitals, hence the continued need for the subsidies.
Of course.
Go ahead, I'm sorry.
No, I said of course.
Yep. Transformation initiatives are generally public between the hospitals. Communication strategies with the hospitals involved and their local communities is strategized between the health department and those hospitals to make sure that those communities are informed of what transformation initiatives are going on. So there is a lot of interaction with the local surrounding communities of those 28-ish, I don't know the number off the top of my head, I apologize, hospitals throughout the state. And we do very much consider, what the public opinion is as it relates to those and how we proceed on a going forward basis.
And the relationship with us and like DHCR and DOH.
Yep.
The
So,
housing These are separate sort of pieces. I'm assuming, maybe wrongly, that DHCR is at least talking to the community board relating to the RFPs when they're formulating the RFPs and getting the input about what's going to sort of be constructed on these sites.
Yep.
And I haven't seen any backlash to that, but I'm assuming they talked about it.
Let's assume there hasn't been any.
And HCR is actively involved in terms of the RFP process, identifying community needs within the areas to ensure that the 4 properties that Atlantic Avenue owns and is designated for this Vital Brooklyn initiative. Those 4 properties, HCR ensures that whatever is developed on those property meets the community needs. And that's done in conjunction with DOH and DOB involvement and HCR involvement, obviously. They're the kind of the
Projects don't
coordinator.
happen, right, these projects don't happen without this board's okay, and we obviously are.
That's correct.
We're in favor of providing decent, affordable housing in that community. But we also would like to make sure that the community has an input in that sort of RFP.
Yep. And HCR does ensure that. And as it relates to the final transaction and how the Atlantic Avenue board releases the property, I'll let Craig speak to that unless you want me to try and handle that, Craig.
Well, again, I mean, we own the property. We're being instructed by, DOH, DOB, and HCR. Once a plan has been fully vetted and approved, then we come to our board and request the conveyance of such property to effectuate such plan through Vital Brooklyn, low-income housing. So.
But we are though, as this board, we are contributing to that because we're giving this property for nothing. I mean, I'm not sure what the value is to begin with, but we are giving it into the process. We are contributing. We should get our fair share of credit for this process. I guess at the end of the day, when the big signs are up on the freaking building that, there's a little plaque maybe, yeah. No plaque, but something. It is the sign. Anyway.
If there are no other questions for Ken and Craig, well, let me ask, are there any further inquiries to be made? Hearing none, we've just heard the president's report.
Yes, I did a great job.
You
didn't
did a fabulous job. Is there any other business to come before this board? Hearing none, may I have a motion, please, to adjourn the board meeting? Thank you,
So
Terry.
moved.
John, thank you for the second. All in favor, please indicate with aye. Aye.
Aye.
Are there any opposed? Are there any abstentions? Hearing none, we are adjourned.
Okay, thank you. Let us stop the